Welcome to Logical Ayurveda. So, to be a successful Ayurveda practitioner, it is very important that we do two things. We should keep our concepts extremely silly and simple, as clear and crystal as ice water. Number two, we should under-promise and over-deliver. If we tell the patient that the particular disease will be cured in 30 days, that disease should get cured in just 15 days. Always a quality of ethical practitioner should be, he should under-promise and over-deliver. Whereas the quality of a quack or a fake practitioner is that they over-promise and under-deliver. So, to achieve this both things, today I am going to teach you my most successful combination for Pithaja disorders that my guru taught me that had made wonders or massive success in clinical practice. The combination is nothing but mix of Mahatiktaka Kashaya and Saribadyasava. So, it is a single combination that can cure innumerable infinity number of Pithaja disorders. It can cure pimples in the face. It can cure hyperhidrosis, that is oversweating. It can cure dry skin. It can cure burning sensation. It can cure hair fall for the patients. It can cure white discharge, and it can leukorrhea, and it can also cure urinary tract infection. So, before going into what it can cure, first let us understand where you should not give. Most of the times, the knowledge of where you should not give a certain combination is much more important than where this should be given. So, first I will teach the contraindication of where Mahatiktaka Kashaya and Saribadyasava should not be given. Number 1, patient has ama. How do you know that the patient has ama? You ask him to show his tongue. The tongue is coated, and he feels tired after having food. He feels heaviness after having food. He is always bloated. In such conditions, Mahatiktaka Kashaya and Saribadyasava should not be given because it is little guru to digest. Number 2, in pure Kaphaja Vikaras, you should never dare to touch Mahatiktaka Kashaya and Saribadyasava. Like, if the patient Vyadi is because of the cooling nature of the disease, like sinusitis, Kaphaja Shirashula, and Kaphaja Pratishaya, Kasa, Shwasa, wheezing. Never touch Mahatiktaka Kashaya and Saribadyasava. And number 3, it should be used with caution in rainy and cold seasons. Why I am telling you use with caution in rainy and cold season? Because even in summer season, we have the patients that comes to us with sinusitis. And even in winter season, the patient comes to us with the heat boils. So it does not matter, give according to the dosha, but when it is cold, always remember to use with caution because the combination is very cooling to the body. So, coming to pimples, we can see people spending thousands and lakhs on cosmetic treatment and laser treatment and whatnot to cure their pimples. I literally pity them. I literally feel sorry for them. I literally have feelings for them because Ayurveda can cure their pimples with a 250 rupees weekly medicine that is a combination of Mahatiktaka Kashaya and Saribadyasava. So, 80% of the pimples are Pithaja pimples. How do you identify the Pithaja pimple? It is red in color with a white little pustule that is trying to break out initially. There will be pain on touch. And in second stage, what happens? The pustule breaks out and the pimples later gets healed and it will turn into blackheads or depression at that particular site. That is Pithaja pimples. If there is only plain red color without itching, without pain, without burning sensation, without it get popped up, it is most probably Kaphaja in nature, not Pithaja in nature. So Pithaja pimples always have red color with the white color popping up in the middle, pain on touch, and the pustule which breaks out later changes into blackheads and have a permanent depression over the particular site. So, why always Pitta, when Pitta gets vitiated, people have pimples, people have seborrheic dermatitis, people have scalp psoriasis, etc. Because Pitta is Agni itself. You fire a matchstick, and you keep it in any direction, you turn it upwards or you turn it downwards, whichever direction you turn, Agni will be always facing upwards against gravity. So whenever in the body the Pitta is vitiated, the first thing that is getting affected is Urdhva Jatru, that is head and face. All the problems will come there. When you eat chicken or when you eat spicy food, when you eat anything, first pimples will come, seborrheic dermatitis and scalp related issues, hair fall, etc. will come. So Pitta always affects the head. Remember that. So here, once you identify that is a Pithaja pimple, you give Mahatiktaka Kashayam and Saribadyasava to the patient. Patient will have result within 10 days of giving this medicine. If it is a chronic disease, then it may take some time. But if it is of recent origin, definitely that will give instant result to the patient. Again, if the patient is Agni is less, don't give Mahatiktaka Kashayam. Usually, we prefer Mahatiktaka Kashayam tablet instead of Mahatiktaka Kashayam. Mahatiktaka Kashayam tablet 2 BD before food along with the hot water, and Saribadyasava 20 to 30 ml after food with normal water. So, if the patient Agni is less, instead of prescribing Mahatiktakam for the patient, you can use Gulichadi or Vasa Gulichadi, that will correct the Agni also. So, if you feel it is not perfect Pitta, so something is wrong in this fellow is having a lot of oil fried foods and cholesterol rich foods and little kapha is there in the pimple, it's not pure Pitta, then you can choose Nimbamritasava instead of Saribadyasava. So I'm once again repeating it, you are feeling that the Agni of the patient is very less, he has ama and he has all other kapha associated with it, then instead of prescribing Mahatiktaka Kashayam and Saribadyasavam, you can prescribe Gulichadi Kashayam or Vasa Gulichadi Kashayam tablet along with the Nimbamritasava, because we want you to succeed in every ball that is bowled by the bowler. You need, as a batsman, you need to give a perfect shot. So as a Vaidya, we need to identify the perfect dosha in the particular patient and give treatment accordingly. And for pimples, there are innumerable thousands of patients that is available who comes to us on a regular Ayurveda practice. So curing them is of utmost importance for us.